My name is Joshua Parish. I'm a senior majoring in public health, and today we're going to talk about Huntington's disease. Now, in the spirit of Quentin Tarantino, we're going to start our story at the end. Or we're going to start in Fletcher, North Carolina, about 200 miles from Greensboro, with a 43-year-old doctor named Vince Gilmer. In June of 2006, Dr. Gilmer was convicted of first-degree murder and sentenced to life in prison. His practice was taken over by another Dr. Gilmer, no relation. After working with the new patient, the new Dr. Gilmer realized that his patient's description of their previous physician did not match up with the description of a murderer. He began his own investigation and discovered that the man authorities believed was a stone-cold murderer, in fact, had a rare degenerative neurological disease called Huntington's disease. Now, Huntington's disease is named after George Huntington, who described it amongst his residents in East Hampton back in 1872. Fast forward to 1993, when a group of investigators discovered the gene that actually causes Huntington's disease. Now, Huntington's disease seems to have a higher prevalence in Western nations, as illustrated by this chart. The difference in prevalence could be in reporting systems or in physician training, but there is some evidence that may suggest that the cause of the prevalence rates in other geographic regions may be due to chromosomal differences seen among people. The study, noted here, also pointed to sociological reasons for the rise in reported cases. These reasons can also include the changing perceptions and family shame surrounding mental disorders. Now, there's currently about 30,000 cases of Huntington's disease in the United States. The symptoms typically emerge in adults between the ages of 30 and 50. So less than about 15% of the people with the mutation will actually become symptomatic. And there's about 200,000 people who actually have the genetic mutation on their on the Huntington gene. Approximately 10% of the cases of Huntington's disease affect children or adolescents. The symptoms of juvenile Huntington's disease are somewhat different from the adult onset and may include awkward walking, increased clumsiness, and changes in speech. The symptoms may also include an inability to learn new information or the loss of previous skills that a child may have had. Unfortunately, juvenile Huntington's disease tends to progress a lot more rapidly than adult onset. For adults, signs and symptoms may include mood swings. They may become uncharacteristically irritable, apathetic, passive, depressed, or angry. Commonly, the earlier the symptoms occur, the faster the disease progresses. There may also be changes in judgment, memory, and other cognitive functions. Interestingly enough, there's also evidence for changes in handwriting, which is something that was noticed in the Dr. Gilmers. Now, Huntington's disease is a hereditary autosomal dominant neurodegenerative disease. Now let's take apart that sentence. Because it's hereditary, that means it's inherited from a parent, either a father or a mother. Because it's dominant, that means either parent can pass it to a child, and if the parent has the disease, they have a 50-50 chance of passing it down. As a neurodegenerative disease, that means it will continue to destroy the brain, and the symptoms will continue to get worse. As I mentioned earlier, there is a Huntington gene, which is on chromosome number 4. In people who get the disease, there are more than 40 triplet repeats causing too many codons on the chromosome. A person who has Huntington's disease can't do anything to slow the progression of the disease, nor can they do anything to avoid getting it. Diagnosing someone with Huntington's only takes a simple genetic test. Now, genetic testing brings up an interesting point because it raises an ethical question in that there is no effective treatment for Huntington's disease and there's also no way to prevent it. So once a person has a defective gene, that doesn't necessarily mean that they'll become symptomatic. So it brings up the question, is there really a value in knowing? It also brings up a discussion about genetic discrimination. As part of the Affordable Care Act, insurance companies aren't allowed to discriminate on people based on genetic testing. Now, Huntington's disease can be discussed in this sphere because a person who has the genetic marker for disease is at an increased risk for needing the necessary treatments to combat the symptoms of the disease. But they will eventually die. As far as treatment, there is really no effective treatment for the disease, but you can treat the symptoms. Some individuals are treated with SSRIs to treat the side effects, which may include depression, anxiety, irritability, fatigue, sedation, decreased concentration, and restlessness. For individuals who suffer from Huntington's chorea, they may also be treated with tetrabenazine for the involuntary bodily movements. Now, when we discuss testing about the disease, the one benefit is that it does allow for partners to make informed decisions about having children, and also can promote discussions about end-of-life care should an individual become symptomatic of the disease. There are also some emerging therapies that focus on doing repairs at the genetic level. Of these, the most promising includes RNA interface therapies. In conclusion, there are no Healthy People 2020 goals for Huntington's disease, and the only promising areas are really in the fields of genetic research. It'll be interesting to see what happens in the upcoming years as the healthcare law and some of the other federal priorities for research change. As I mentioned in the beginning of my case study, the story of Dr. Gilmer is incredibly interesting, and he was featured on an episode of This American Life. I won't tell you what happens at the end, but I strongly encourage you to listen to the episode if you have some free time. Thanks, and have a great day.